Saya sangat senang sekali dalam kesempatan ini bisa berpartisipasi. Kemudian terima kasih yang sebesar-besarnya untuk Ola Group ya yang sudah membawa saya ke dalam webinar ini, di mana stem cell yang dibawakan oleh Prof. Nose ini sangat amazing ya, sangat bagus sekali, terutama untuk di bidang kami ya, di bidang anti aging, estetika, kemudian kulit bahkan dan untuk kelamin ya, untuk perbaikan sel-sel kelamin, sel kulit ya itu sudah banyak risetnya. Jadi saya berharap dalam webinar ini nanti dijelaskan secara singkat dan gamblang apa yang membedakan stem cell dari Jepang yang dibawakan oleh peneliti Dr. Nose. Semoga bermanfaat bagi kita semua. Terima kasih, saya akan kembalikan pada moderator.
Oke,
Dr.
terima
Oke.
kasih. Ya, terima kasih, Vanessa. Jadi, bagi Bapak Ibu sekalian, dokter-dokter sekalian yang nanti mau melakukan perawatan, itu nanti Anda bisa konsultasi juga dengan Dokter Vanessa ini, terutama di bidang kulit dan estetika, gitu. Oke, sekarang teman-teman sudah siapkan koneksinya yang pasti harus terkoneksi dengan baik. Jangan sampai nanti pada saat Dokter Nose bicara nanti ada gangguan bukan dari yang lainnya tapi dari koneksi. Ya, terus kemudian nanti teman-teman kalau ada yang menanyakan sekali lagi itu silakan Anda tulis di kolom chat, gitu ya. Nanti akan dijawab satu persatu oleh Dokter Nose. Oke, Dokter Nose, good evening.
Good evening.
Okay, please, can you explain exosome plus?
Sure.
Okay.
Let me share my computer screen.
Oh,
Yes, please. Yes, please, Doc.
I can't share my, you know.
Tolong bikin
Pak.
co-host, Ton.
Ya, Pak Anton, tolong
Jadi
itu
co-host.
jadiin host Mr. Nose ya.
Oh, okay. Now I can do that.
Okay,
Thank you.
now can.
Okay, so first I wanna introduce myself briefly. So is it okay? So I guess some of you may misunderstand, but I'm sorry, I'm not a medical doctor. I'm a doctor of science. I have a PhD. I'm a scientist. Okay, so I educated in Japan, especially in Hiroshima University. I got PhD in biology, and then I have several appointments. So first I went to the and postdoctoral researcher and kind of special appointment associate professor, and then I went to the US University of Michigan, and then moved to Duke University, and I come back to Japan, and I got appointments in the current company, I mean Biomedical Synthesis, and I do research and also business development. Okay, so this is my company's profile. So the name is Biomimetic Synthesis, established in 2000. So it's a the 23 years old company. Just 2 days ago we had the company has a birthday, and what we do is research and development of the exosome plus and also cell culture medium for the regenerative medicines. That is what we do. So what is exosome plus? As you may know that exosome plus is a kind of, the cell culture supernatant. When you culture the mesenchymal stem cells, then the cells excrete various factors, including exosome, of course, and growth factors, cytokines, hyaluronans, and so on. So if you remove the cells, then you got a supernatant containing lots of various factors, these factors, that we call exosome plus. So why we call exosome plus? Because it contains a lot of exosomes. So this is a comparison of the exosome, HGF, and TIMP1 with other companies' conditioned mediums. So left two bars shows exon plus lot number 1 and lot number 2. And the others are conditioned medium obtained from other companies. And if you see, companies 1, 2, 3, and 5 doesn't contain any exosomes. Well, companies 4 contains, but we have more exosomes in the conditioned mediums. Also, HGF and TIMP1, many companies' conditioned medium doesn't contain any these factors, but our exon plus contains a lot of these, growth factors. So that is why we call it exon plus, especially, now for the, is it okay? Maybe, somewhat translate to the Indonesian, right? Well, can I continue?
Yes, please, Doc. Please.
Please continue.
Okay. So as I said, the stem cells excrete, I'm sorry, excrete a lot of factors that do various things, that have the various functions. For example, anti-inflammations and stimulate neurogenesis, anti-apoptosis, and sometimes, it's okay. All right. So these factors makes stimulate cell growth and immunomodulation, angiogenesis, and so on. So the target diseases of these functions gonna be cancer, aging, cognitive impairment, fatigue, skin diseases, and so on. So many diseases can be a target of exon plus because it contains a lot of factors. So by our hand, maybe it contains 350 kinds of growth factors, cytokines, and so on. And if you go more deep, then you can find more factors. So maybe 400 or 500 factors are included in the exon plus. So one of the features of exon plus is the safety. This is a brief scheme of how to make exon plus. So first, we got the tissues from donors. For example, skin fat or sometimes umbilical cord. And then the stem cells are isolated from these tissues. Then we put the medium, we call it AOF, animal origin free, a special medium, to the culture dish and culture these mesenchymal stem cells. Then, we got a lot of factors in the supernatant. So we call it supernatant and filter, sterilize. Then we get the exon plus. So this is a brief scheme of how to make exon plus. So the important factor is the medium, because the supernatant is almost consists of medium. So safety of the medium is very important. There are lots of kind of mediums in this world. So many laboratories use serum medium. That means serum containing medium. The animal serum are used for the tissue cultures. But as you know, the animal serum contains a lot of unknown factors, and sometimes it contains unknown viruses. That makes exosome plus very harmful. So it doesn't work for the clinical issues. Then there's a serum-free medium or xeno-free mediums. They don't use serum, but they usually use the tissue extracts from human or animals. That also make medium contaminations. So it's not so safety. Then we develop our original medium called AOF, animal origin free mediums, that doesn't contain any stuffs extracted from animal or humans. So it's very safety. It's very safe medium. So our Exosome Plus is one of the top safest condition medium or exosomes in the world. So you don't need to worry about the animal allergies or some kind of contamination of the germs. We also check the tissues from donors. So before we get the tissues from donors, we do the donor screenings. Get the blood and check these viruses. And after make the Exosome Plus, we also test these pathogens. About 19 kinds of virus tests and also mycoplasma. So the Exosome Plus is very safe. So how about the efficacy? So one very unique character of our Exosome Plus is we can use it for cancers. So this is in vivo and in vitro experiment results of the Exosome Plus. So if you see the left panel, this is in vivo mouse experiment results. If you put the human cancer cells into the immunocompromised mice, then cancer cells grows very fast. As you see, the red or pink lines, so this is the growth curve of the cancer cells in the mice. So the cancer cells grows very, very fast. But if you put or inject the stem cells or exon plus generated by us, then you see the cancer growth are stopped like this. So our exon plus suppress cancer growth in mice. So right panel, this is an in vitro cancer cells experiment. If you culture the cancer cells like MCF7 or MM2331 and HepG2 like this, and if you put the exon plus into the culture system, then you see the cytotoxicities. That means kill the cells like this. So if you see the higher red bars, that means more cancer cells are died. So uh, 4 out of 5 cancer cells, exon plus shows cytotoxicity for cancer cells. So exon plus can attack cancer cells in this in vitro experimental conditions. So how about in human? So this is a clinical case of the breast cancer. Well, I don't say only exon plus can cure the breast cancer in human. But if you use the exon plus with anti-cancer drug, then you may get a very good results. So this is a case of breast cancer stage 4. So if you see the very big cancer lesions, it also exposed to the surface. Administration of exon plus and anti-cancer drug at the same time through the cannulation into the artery. So 6 times of administration was performed. Then you see after I think that was after 3rd time, the cancer lesion was dropped off. And, and you see the hole on her breast. So usually doctor do the skin graft from the butt, but at this time, no skin graft performed. But you see her breast was recovered pretty well. I think, or we think that this is because of the exon plus. So exon plus contains a lot of growth factors, and also and that helps tissues recover very well. So this is what happened if you use the anti-drug cancer with exon plus. Well, okay, this is the kind of best case. This is kind of champion data, but it may happen to any cancer patients. This is also the case of small intestinal cancer. This is a very rare case of the cancers, but the patients got emergent transplantation and diagnosed with stage 4 small intestinal cancers like this. And at that time, the doctor told him that he had 1 year and a half to live. And he also did the surgery to take the cancer lesion out. But at that time, the peritoneal metastasis were observed. But after that, he did the kind of anti-cancer therapy called HITV, this kind of special treatment, and also get the chemotherapy. But between these treatment, he got the exon plus infusion. I think this is a 30 milliliter each for several times. Then, the September of this year, he got a CR, complete response, and no sign of recurrence and metastasis of cancer at that time. So he got a very, very nice result at the time. But unfortunately, after several months, he have recurrence of the cancer again. So this is kind of pity, but once he got a CR. So this is what happened. I don't want to say that, the exon plus is a medicine almighty. So this is not a perfect, but sometimes, this exon plus works pretty well, but it's not perfect. But anyway, for some patients, it works very good. let me introduce other cancer case. So this case was breast cancer, I already told you, it's a stage 4. And this is case 2, papillotubular carcinoma, stage 1A. So this is a kind of early stages. And for this patient, intra-articular injection of anti-cancer drugs and followed by 5 ml of Exon Plus and embolized. And once a month for 3 times, the patient got this treatment. So the cancer was shrunk and alleviated skin problems caused by anti-cancer drugs. And this is the 3 months later, stage 1A turned to CR. So very early stages cancer, Exon Plus helps a lot. For case 3, lung adenocarcinomas, so stage T2. So this is also this patient also got the intra-arterial injection of anti-cancer drugs followed by 5 ml of Exon Plus and embolized. Pretty much did the same thing, and once a month for 3 times. And during the treatment, the cancer progression was slowed down. Yeah. But once the treatment was stopped, then growth of cancer was observed again. So Exon Plus also works okay. Yeah, it's fine. But once you stop the treatment, then cancer growth was again. So, you know, it's not a perfect, but still it helps a lot. And I didn't write down, but in most cases, usually, you know, during the chemotherapy, a patient got a pain, and sometimes, you know, kind of dizziness and you know, feel bad and vomit. But if the patient get Exon Plus, then most patients said almost no pain. That's very good, you know. This helps the patient's QOL a lot. So if the Exon Plus won't kill the cancer cells completely, but it also helps patients to fight to the cancers. So this is not only for cancers, but also other diseases. For Exon Plus, there are no standard protocols. I'm sorry to say, but still, you know, the doctors have been working on figuring out the appropriate methods.
Excuse me, Dr. Mose.
Yes,
Can I help you to translate in Indonesian
Sure.
simple way? Okay.
sure.
I will explain this case for all the audience maybe. Jadi ini ada satu kasus kanker usus halus stadium lanjut yang sudah masuk ke dalam kelenjar getah bening stadium 4 ya, yang sangat jarang karena ini ada di usus halus, biasanya usus besar atau lambung kankernya. Tapi ini benar-benar di usus halus stadium 4 karena sudah menjalar ke kelenjar getah bening dan ukurannya banyak dan besar. Nah, kemudian dokter sudah melakukan mengambil daripada kankernya dan kelenjar getah beningnya melalui operasi laparoskopi untuk memperpanjang hidupnya. Tetapi menjalar sampai ke dinding usus atau lapisan jaringan lemak di bawah kulit usus perut ya. Kemudian bulan 6 tanggal 30 Juni 2021 mulai diinfus human initiated therapeutic vaksin terapi dan kemoterapi. Di antara kedua terapi ini diinfuskan juga Exosome Plus Jadi melalui pembuluh darah langsung, selain ada terapi yang lain itu ya, kemoterapi dan lain, tapi tidak bersamaan. Di antara dua kemoterapinya, dia dikasih exosome plus. Nah, kemudian 15 September 2021, setelah dilakukan, tidak disebutkan berapa kali, biasanya katanya 2 minggu atau 4 minggu sekali, akhirnya ketahuan September udah nggak ada lagi kanker. Tidak ada penjalanan lagi. Tapi sepertinya pasien ini berhenti dan tidak melanjutkan exosome plus-nya. Saat ini katanya kankernya muncul lagi. Jadi beliau mengatakan bahwa exosome plus itu bukan tidak bisa mencegah munculnya kanker lagi, meskipun dia bisa menghilangkan bahkan mengurangi kankernya, karena tergantung juga pola hidup pasiennya. Yes, please, Dr. Nose.
Okay,
Continue.
thank you. Yep. And again, so what the doctor do is, I told you that many doctors or, some kind of special doctors do the intra-article injection close to the cancer region just after anti-cancer drug injections. Maybe, 5 to 10 ml of Exxon Plus is sufficient for these protocols. Or otherwise, intravenous infusion of 30 to 60 ml of Exosome Plus 1 to 7 days before anti-cancer drug treatment. That is what doctors do right now. And he or they are trying to figure out the better conditions now.
Oke, jadi ini diberikan infusnya, bisa disuntikkan intratekal 5-10 cc atau melalui infus, yaitu 1-7 hari sebelum kemoterapi atau 1-7 hari sebelum obat-obat kimia itu. Cara melakukannya kepada kanker yang ini. Yes, Dr. Nose, please.
Okay. And for for pains in the joints or in the muscle, just direct injection is fine. So in the maybe knee 5 ml in intra articles, and for the other joints maybe smaller volume is okay. And for the muscle pain, maybe 1 to 2 ml each. And for
Oke.
Mhm.
Oke, jadi ini untuk sendi-sendi, misalnya nyeri lutut, kemudian tulang-tulang belakang, biasanya disuntikkan langsung di samping-sampingnya, itu 5 cc ya, 5 ml. Seperti itu. Pada otot paling 1-2 ml. Langsung dari jarum ke ototnya, atau kalau lokasi nyeri itu. So it's for osteoarthritis and it's anti inject intrathecal, dokter, intramuscular.
Yes. Yeah.
5 ml, you said 5 ml?
5 ml.
5 ml every point 1 ml or 5 ml in 1 point?
I'm sorry. 5 ml for the knee joints.
Yeah, it's for the knee joint. We have to inject 5 ml.
Yes, around 5. 5 would be okay.
5 ml, but in 1 point, or become 5 point around the knee.
Not around, in the knee joints.
In the knee joint, straightly.
Yes, joint.
Oh, okay. So the orthopedic can do it. Thank you.
Mm-hmm. Okay, and of course, that every medicine doesn't have any guarantee. Usually it works, but for some person it doesn't work. That may happen. So please, don't think that Dexon Plus is, the medicine almighty. It's not I don't know how to say in English, 万能薬, but anyway, sometimes it doesn't work. It may happen that it doesn't work for some special person. Still, we don't know what is what the best protocols yet. So
Oke.
no guarantee. Yes.
So, Dr. Nose selalu ingatkan bahwa semua pengobatan tidak boleh kita mengatakan ada garansinya bahwa pasti sembuh. Karena kan setiap orang berbeda, stagingnya juga berbeda. Jadi jangan menganggap bahwa exosome plus ini sesuatu obat dewa yang langsung disuntik, langsung disembuh. Bukan. Tapi itu sometimes kadang-kadang disuntikkan pun belum ada efek apa-apa. Makanya kenapa sekarang masih tetap dilanjut lagi, masih belum menemukan pakemnya yang untuk case yang berat seperti apa, tapi yang sudah dilakukan memang tampak ada hasil. Thank you, Dr. Nose.
Okay. Okay. So I told you that Exon Plus has an anti-inflammation effect. So this is a in vitro experimental model of the blood vessels. So if you culture the endothelial cells of the blood vessel, and if you stimulate the inflammation by adding the TNF alpha, then the endothelial cells secrete the inflammatory cytokines like IL-6 and IL-8. So if you put this cell culture system, the TNF alpha, you see the excretion of IL-6 or IL-8. But in this system, culture system, if you put the exon plus, then you see the drop down of the levels of the IL-6 or IL-8. So that means, exon plus can suppress the inflammation in the blood vessels.
Ya, oke, I translate dok. Jadi exosome plus ini ternyata juga sangat bagus untuk mencegah terjadinya peradangan pada dinding pembuluh darah bagian dalam yang disebut sebagai endotelium. Karena faktor-faktor radangnya bisa ditekan, yaitu terutama kalau kita periksa lab, IL-6 kita tinggi, IL-8 tinggi, itu menunjukkan ada radang atau penebalan-penebalan atau reaksi inflamasi pada dinding pembuluh darah bagian dalam. Nah, itu nanti yang memunculkan banyak luka dan jadi plak. Ternyata exosome plus bisa mencegah terjadinya penebalan dinding pembuluh darah atau radangnya. Jadi juga bisa mencegah terjadinya gumpalan-gumpalan faktor-faktor darah yang menggumpal. Sehingga mencegah terjadinya apa? Lanjutannya mencegah terjadinya stroke, hipertensi dan lain-lain dan serangan jantung. Jadi ini benar-benar sangat bagus untuk dinding pembuluh darah. Karena kita punya dinding pembuluh darah itu yang sering menumpuk dan inflamasi radang menjadi plak. Oke, Dok. Thank you, Dok.
So, recently it is said that aging is systemic inflammations, including the blood vessels and muscles and neurons and other tissues. So if you suppress systemic inflammation, then you can be rejuvenized. Getting younger.
Dikatakan bahwa kalau kita menua, semua dinding pembuluh darah kita pun dan semua darah kita juga mudah terjadi inflamasi atau radang. Makanya kenapa bisa dicegah penuaannya, jadi tua menjadi membaik, reverse aging dengan cara menyuntikkan exosome plus tersebut. Thank you, Dokter.
So I told you that the exon plus can suppress the inflammation. That means exon plus can be used for anti-aging, right? And actually, the GDF15, this is the marker for aging. If so that I think 9 persons got the infusion of Exon Plus for several times, actually 6 times, and monitor the levels of GDF15 in blood. So if you see these graphs, first, second, and third time infusion doesn't work, but after 4 times of Exon Plus infusion, then you see the drop of the GDF15. That means, the body response to the exon plus and rejuvenate.
Yes,
Like,
oke dokter. I translate it ya.
Mhm.
Oke, dari teman-teman, bapak-bapak ibu sekalian, anti-aging cara bekerjanya dari exosome plus adalah dengan menurunkan produksi daripada GDF15. Ini adalah yang memicu penuaan atau aging, disebut sebagai aging marker, dan merupakan gejala juga orang ini akan muncul cancer. Cancer marker juga ini diperiksa GDF15. Bila mana dilakukan penelitian oleh timnya Dr. Nose, diinfuskan exosome plus 30 mili seminggu sekali selama 6 kali berturut-turut, berarti 6 minggu, maka kita lihat di sini di grafik mulai suntikan keempat, yaitu minggu keempat setelah infus 30 mili exosome plus, maka jumlah daripada produksi GDF15 yang menyebabkan penuaan dan kerusakan dan kanker ini menurun. Jadi stabil, turun tetap di bawah, garis bawah, artinya rendah sekali GDF15-nya setelah 6 minggu dilakukan. Yes, Dok.
Okay.
Continue.
Yep, thank you. And the GDF15 is also known as a cancer marker. So I told you that the exon plus can kill cancers. It is said that every day in our body, 5,000 cells of cancer are generated. So maybe the exon plus maybe may kill the cancer cells. So that is why we also see the decrease of the GDF15.
Ya, jadi ternyata memang benar-benar kemungkinan besar exosome plus ini kalau diinfuskan 30 mili seminggu sekali, maka bisa membunuh semua sel kanker yang muncul. Karena setiap hari ini tubuh kita masing-masing selalu memproduksi sel kanker. Jutaan sel ya, lebih dari 1 juta sel setiap hari dari penelitian. Dan itu bisa direduce, bisa dihancurkan oleh exosome plus. Sehingga tidak akan muncul menjadi suatu kanker. Thank you, Dok.
Okay, this is another case of the exon plus infusion. So the patient got the spinal injury sequelae. So this is a movie. So let's see this one. So this patient has a paralysis, especially on her right side. So she cannot bend and expand fingers smoothly. And
指がね。次にちょっと握ってもらった時どうかな。
well, she can bend fingers, but cannot expand very well.
はい、そうなんです。一本ずつが動きにくいと。今度ね、腕を思い描いたところで。
Oh, sorry. And she cannot rise arms, especially on her right side. And she walks very slowly and not so smooth.
Sorry, doctor, is it the spinal injury in the vertebrae cervicalis neck?
I'm sorry, yeah, this is a spinal injury, but sequelae, yes. Not so tough, but it's kind of mild. But on her right side, as you see, she got a paralysis, and she also suffer from pain. Okay, so this is just before, and after exosome infusion within 30 minutes.
Ini adalah 30 menit setelah diinfus exosome. Yang tadinya nggak bisa buka
Now
tangan, nggak bisa buka jari itu.
it can bend and expand very smooth and quick and pretty well. And she can raise her arms better than before.
Ya, bisa angkat lengan kanannya lebih tinggi daripada sebelum diinfus exosome plus.
And she can walk faster.
Dia bisa jalan lebih cepat.
It's hard to see, but she smiled. Yeah, she said, I'm happy. And she also
Ya,
said,
dia bilang
you know, there's
dia
no pain.
bahagia.
Okay.
Yes, please, Doc. Yes,
Okay.
Doc.
So this is a case for chronic pain. This is the published data, and you know, there's a lots of pain with lots of the various degrees of pains in various places, and the average of the pain is about 5. So this is the NRS. So 10 is the most painful case, and the 0 is no pain. So the average of the pain is about 5, but the exon plus are injected intra-articular or intramuscular for about 5 ml for the knee joint, and 2 ml, 1 to 2 ml for the intramuscular injections. So after within the 15 minutes, the pain scale was dropped like this. So it kills the pain very quick. After 1 day, 1 week, or 1 month, the levels are a little bit increased, but still lower than the initial levels. So the Exxon Plus works for a pain very well and very quick.
Yes, I translated. Jadi, excuse me, oke. Jadi yang disuntikkan untuk sebagai anti nyeri itu diberikan kepada masalah lutut osteoartritis, kemudian shoulder arthritis yang sendi bahu nggak bisa diangkat. Ini post operation setelah operasi lutut. Kemudian heel fasciitis itu adalah karena nyeri pada telapak kaki karena pakai sepatu tinggi. Hip sciatica itu yang dipanggul, nyeri dipanggul gitu ya untuk jalan. Kemudian lutut rheumatoid arthritis atau juga ada HNP atau kecetit ya, orang Jawa bilang kecetit di tulang belakang. Kemudian epicondilitis of the humerus. Humerus itu tulang daripada lengan. Kemudian semuanya bermasalah dengan lutut, tennis elbow, lengan, waist, block, shoulder, baik arthritis, semuanya berhubungan dengan sendi-sendi. Nah, itu dilakukan suntikan intraartikuler. Kalau pada sendi itu di sendinya, itu nanti dokter spesialis ortopedi melakukan, atau bisa dokter spesialis saraf melakukan pun boleh, yaitu intramuskuler, langsung pada ototnya yang nyeri. Dari grafik itu tampak, kalau skala nyeri itu 0 sampai 10, 10 pasti nangis, nggak bisa diem. Kalau skalanya 5, begitu disuntik, nyerinya turun sampai skala 1. 15 menit kemudian, dan berkurangnya nyeri itu bertahan sampai minggu keempat atau 1 bulan. Itu yang sudah diteliti dan sangat menolong mengurangi penderitaan orang. Oke, Dr. Nose.
Okay. So this is a case of the burn. The person gets a very hot water. Actually, it's not a water, but something hot on her foot, and it got degree 2 burn, and this is region reached to the hypodermis for about 2 to 3 weeks. So the doctors recommend her to do the skin graft, but just after that, she started to spray the Exxon Plus every day. So day 3, see the spots are started to close, and they actually this is day 7. You see the blood vessel-like structure in this region, and the region was shrunk, and finally the wound was closed completely. So it also
Ya,
happened. Yeah, go ahead.
oke. So, ini adalah luka bakar pada kulit, grade 2. Ya, terkena sesuatu yang membakar kulitnya, yang harusnya harus dioperasi, ditempel skin graft dari kulit lain. Tetapi tidak dilakukan, nggak mau, ya hanya di-spray, disemprot-semprot exosumplas setiap hari. Pada hari ketiga dan selanjutnya, bulan April tanggal 8 mulai muncul pembuluh darahnya, lalu luka bakarnya menyempit, mengecil, maju lebih bagus terus sampai akhirnya luka bakarnya tertutup sendiri pada bulan 6, 2 bulan kemudian tiap hari dilakukan spray atau semprot exosumplas. Dokter, may I know how much the dose for spray is should together with infused water or only the exosome?
Just
spray?
only Exxon Plus.
Only exosumplas. Okay. Thank you.
Sure. And this is not Exxon Plus, I'm sorry, but this is a stem cells, generated by our technologies. Pretty much same with the Exxon Plus. But the person, this guy got boiled water on his face. So he got a very bad burn case. But we gave him the infusion of stem cells and also subcutaneous injection of stem cells for several regions. So after 4 months after that, his skin was recovered completely. Yeah. So this is not Exxon Plus, but these stem cells generated with the very same technology. And stem cells secretion factors are pretty much same. So we think that Exxon Plus also works for burns pretty well.
Ya, jadi ini luka bakar juga, kena air panas mulai kepala sampai leher dan dadanya, luka bakar, 5 liter airnya. Nah, tetapi yang kasus ini karena cukup berat, luas, makanya diinfus stem cell hidup, bukan cuma cairan exosumplas, tetapi benar-benar 35 juta stem cell hidup dimasukkan lewat infus. Juga stem cell sebagian dimasukkan suntikan subkutanius di bawah sudut 45 derajat di bawah kulit, diinjeksikan juga. 4 bulan kemudian hasilnya kembali normal dan perfect. Thank you, dokter.
So this is a case of atopic dermatitis. And also this is the case of with stem cells and Exxon Plus. So he had a very bad atopic dermatitis. So he got the infusion of stem cells once. And then, he put or apply Exxon Plus on his face every day. For 2 months later, he got a very nice skin compared to the before the treatment.
Ya, so ini adalah penyakit kulit atopic dermatitis. Sebetulnya atopic dermatitis dokter Vivi nanti bisa jelasin apakah autoimun atau bukan. Tetapi dilakukan infus stem cell lewat darah, juga dilakukan pemberian exosome plus. So di exosome plus spray or injection, dokter?
Spray.
Oh, spray ya. Jadi
Yes.
exosome plus di spray, tapi stem cell yang hidupnya infus. Nah, 2 bulan kemudian kulitnya jauh lebih bagus dan mendekati normal. Thank you, dokter.
So this is also the case of atopic dermatitis, but it's not so bad case. So she just spray or apply the Exxon Plus every day on her forehead. And if you see compared to the before treatment, after 2 months treatment, well, she got better skin conditions.
Ya. Jadi ini juga sama atopic dermatitis atau penyakit kulit alergi sebetulnya ya. Itu cuma di spray-spray aja karena nggak terlalu parah. Disemprot-semprot exosome plus 2 bulan kemudian hampir tidak tampak ya. Jauh lebih bagus. Thank you, Dok.
Okay. So this is the case of hair growth. Actually, he didn't want to do anything on his head, but he got a stem cell infusion for other diseases. But after that, after infusion, about almost 1 month, he got very nice black hairs.
Ya, jadi ini kasus kebotakan. Dia nggak mau disuntik di kulitnya sepertinya. Jadi dilakukan infus stem cell hidup 1 kali. 1 bulan kemudian rambutnya tumbuh banyak sekali.
So now we know that the stem cell works for the hair growth. Then Exxon Plus may also work for hair growth. So the person did the spray Exxon Plus every day. See, this is the start point. He's a bald, but 10 days later and 20 days later, he got black hair like this. So if you see compared to the before and after that, he got the very nice hair. Just spray Exxon Plus. Well, I say, of course, this is the champion data. I don't say everybody got the same results, but someone very respond to the Exxon Plus get the same results.
Jadi ini kasus benar-benar botak kulit plontos ya. Oktober 2011, bulan Oktober 2011 mulai disemprot exosome plus saja. Dia rajin semprot sampai 2012. Januari rambutnya sudah tumbuh banyak sekali. Ini adalah kasus yang bagus. Kemungkinan besar kalau kasus kebotakan seperti ini dengan beliau berhasil, maka pada pasien-pasien yang lain kasus seperti ini bisa juga berhasil. Thank you, Dok.
I think this is time, so maybe the presentation should be closed, right? So if you have any questions, just ask me. And I'm sorry for the messy English. If I can, do the presentation, directly to you, maybe I can do better. I can do my body language, and but in this case, I don't see you guys, so it's not easy to explain in English, by myself.
It's okay, Dr. Nose. Your English is very clear for us, actually.
You are so generous.
But because not all of us are doctors, so I help some for Indonesian translate. So I back to Dr. Oka as the moderator, please. Dr. Oka, please.
Okay, sorry. Thank you, Dr. Nose, for the presentation. This is some few question.
Okay.
Maybe you can answer. First question from Miss Valen. How about the chance for very bad allergy? Already stem cell secretum 5 times, but no sign for better condition.
Mm-hmm. So what kind of allergy?
Miss Valen, can you explain? What
Skin
allergy?
allergy, skin allergy.
Skin? You mean atopic dermatitis or other?
Biduran ya Bu, biduran ya, urtikaria ya, urtikaria, biduran.
Jadi kalau makan apa aja tuh gampang gatel, terus gatel-gatel, merah-merah, bentol-bentol.
Food allergy, dokter. Itchy after eat something. Dokter Nursi kayaknya freeze.
I'm sorry, but so anyway, so the allergy on the skin, right?
Yes.
So, well, let's say the exon plus can modify the immune systems. I mean, if you have the kind of overworking immune systems, then its exon plus may suppress. And if you have the very low immune activities, then it stimulates the immune systems. So exon plus can modify the immune systems. So maybe it helps you to alleviate the allergies. But honestly, I don't know yet. But for if it's well, let's say inflammatory, some kind of allergy. I'm sorry, but you can try. You can try, and maybe infusion first, and then
Infusion of the exosome, doctor.
Yes, exon plus, infusion of exon plus, and then apply the exon plus on the skin.
Apply.
Yes, would be better.
So how about the dose? 30 milliliter?
Yeah, 30 for infusion, and maybe
every week?
Yes, IV 30 to 60.
Oh, every week for how many times?
Let me say, if possible, yes, every week. But it's not so cheap, I say. So maybe once a month.
Karena tidak terlalu murah, sebulan sekali aja infus 30 cc kan. Thank you, Dok.
Yeah, and at this point, depend on my knowledge, adipose tissue exon plus would be better than the umbilical cord.
So, doctor, how we know that the exosome plus from umbilical cord, the other is from adipose tissue from your laboratory? Any different name?
From our laboratory.
Oh, okay.
Yeah.
So any different name? Like
I'm sorry?
The exosome from adipose tissue,
Yep.
or exosome from umbilical cord, you give the name not same like exosome plus or supernatant or what, or crystal exosome maybe?
Maybe exon plus, it's a little bit different, between adipose tissues and umbilical cord. And at this point, depend on my knowledge, for the atopic dermatitis, I mean adipose tissue exon plus would be better than umbilical cord.
So your laboratorium make it different from adipose, different than from
right.
Jadi
in,
dibuat yang berbeda dari lemak atau dari umbilical ari-ari bayi gitu. Thank you,
in
dokter.
yeah, in many case, both works fine. But especially for the atopic dermatitis, the adipose tissue would be better than umbilical cord.
Thank you. Dokter Oko, silakan dokter.
Okay, thank you, Dr. Rose, for the explain. This is question number two from Imi. She asked about how to inject exosome plus in the gluteus or in the painful area.
Painful area? Oh, you mean yes, painful area. You mean the local injection, right?
Local injection.
Yeah.
Sorry, exosome plus is by IV. When there's a pain in any area, that is using the exosome plus relief. It's totally different thing. So Professor Nose, you must explain to them, exosome plus is for IV. But when there's pain, it's using injection.
Oh, okay. Thank you for the explain. Okay, this is question number 3 from AKH. Hello, Nose Sensei.
Yes.
Can you share to us human clinical subject demography?
I'm sorry.
Okay, I will. Can you share to us human clinical subject demography?
Human clinical subject
demography.
Wrinkle.
Oh,
Saya
wrinkle.
Kerut dia, Dok.
Yeah.
Human wrinkle.
Yeah. Okay. You mean inject for anti-wrinkle? Yeah, it works. Exon Plus also works for the wrinkle. Yes.
Okay. Maybe you have a patient. Mungkin you have a photo.
A photo?
Yeah.
Okay.
For this case.
Let me check my computer. Yes, yes, I do have. Just a moment, please.
Okay.
Before after ya, dokter.
Yeah.
Before and after injection.
Yeah. I know. Just a moment, please.
It is the clinical demography, not the wrinkle.
Oh, clinical demography.
Okay, just a moment, please. Okay, where is it? I have so many files, so it's hard to find out. Let me see this one.
Jelaskan maunya bukan dau, Ika Kandau ya.
Mungkin yang punya pertanyaan mungkin bisa dijelaskan kalau ini.
Okay. Let me share the slide. Okay, sorry, this is written in Japanese. But here, the Exon Plus locally injected, I mean the subcutaneous injection of Exon Plus for the wrinkle part. And this is 2 months later. So still, you see the less wrinkle. And these, figures show that this is the expression of 31. Maybe you know that this gene is for the long life, and the expression of this gene is stimulated by the exon plus. So this red bar means exon plus. This is a kind of in vitro experiment. So if you culture the skin cells and put the exon plus, then you see the stimulation of the expression of 31. And also, this is hyaluron stimulating enzymes RNA. This RNA levels are also increased by the exon plus and also KPRP. This is a very important for the barrier of the skin. And the expression of KPRP is way higher if you put the exon plus in the skin cell culture systems.
Now
So
it will last for how long? Still looks very good until how long?
2 months.
2 months, yeah.
Yes, 2
2
months.
months. And then
Yes.
long lasting on, you have to repeat again. Apakah diulang lagi, repeat again?
Yeah, lots of patients, repeat, every month or 2 or maybe, 3.
Okay.
So, usually patient got the injection, I say 6 times a year.
Oke, katanya 6 kali dalam sebulan diulanginya. Mungkin 2 bulan sekali kalau masih muda. Mungkin kalau lebih tua, seumur-umur saya perlu 4 minggu sekali mungkin. Yes, please, dokter. Thank you.
Yep, that's it. Yep.
Okay, thank you, Dr. Nuse.
Mhm.
We have another question.
Mhm.
What is the effectiveness comparison statistically with exo plus or without exo plus in cancer patient, doctor?
I'm sorry. I
Okay, I will repeat.
Catch you.
What is the effectiveness comparison
Comparison, yeah.
for the cancer patient exo plus and without exo plus?
The statistic maybe, doctor.
You have
already
comparison
Comparison, yeah.
in the
About
patient cancer?
what disease you mean?
Cancer.
Cancer.
Yeah.
Cancer.
disease.
Cancer.
Yeah.
Statistic, we don't do that. We didn't calculate yet.
Oh, okay.
Yeah, I'm sorry to say, but it's very depend on the patients. So some patients, as I showed you, it works pretty well. Some patients got a CR, but some patients just slow down the growth of cancer. So it's hard to say at this point. And one more thing, in many cases of cancer, most of them are stage 4.
True.
So yeah, if the patient's cancer got a very slow growth, but the patients are already awakened, and sometimes the patient just dropped from the therapy. That happened. Yeah, it's very sad and pity, but yeah. So this is that just happens. So in Japan, it's very hard to use the exon plus for the early stage cancers, because this in many cases the cancer therapy, how can I say, standard cancer therapy must be done first, and after that we can do the exon plus therapy. So at that time, most of the patients are already weakened, tired, and very bad conditions. So this is a very, very bad. Yeah. But anyway, we are sure that the exon plus help the cancer patients QOL. I mean, the exon plus may kill the pain in many cases. Yeah. And alleviate, I mean, to help the patient to live better.
Can I explain it, dokter?
Mhm.
Ya, jadi tadi Dokter Nose bilang bahwa kebanyakan kanker yang stadium-stadium awal itu harus mengikuti prosedur terapi kanker secara konvensional seperti biasa. Tetapi kebanyakan yang ketemu mencari exosome plus itu adalah pasien-pasien kanker yang sudah stadium lanjut, stadium 4 dan seterusnya, yang sudah ada rasa nyeri, yang sudah menderita terus-menerus, sehingga harus dilakukan QOL, quality of life-nya harus diperbaiki, terutama bebas dari nyeri atau palliative care-nya. Thank you, dokter.
Thank you.
Okay, thank you, Dr. Nose.
Mhm.
This question from Sabrina Yap.
Uh-huh.
Do you have any cases or recommendation for other autoimmune disease?
Well, I'm sorry, but
Like, do you have any cases or recommendation for other autoimmune disease, like multiple
Autoimmune.
sclerosis?
Autoimmune disease.
Yes.
Oh yes. So I told you that the Exon Plus can modify the immune systems. So yes, for the autoimmune systems, the Exon Plus may works pretty well. So the infusion would be recommended.
Excuse me, doctor. Is it for autoimmune disease infusion with exosome plus or with the stem cell?
Stem cell, Exon Plus, both works.
Oh, both work. Oh, okay.
Yes.
Doctor. Thank you.
Okay, thank you, Dr. Nose.
Mhm.
This is another question for the cancer case.
Mhm.
Dr. Iva, she asked about how about cancer in early stage? Can we treat with exosome plus?
You mean you said early stage?
Early stage.
Early stage, yes.
Yes.
Early would be better. Yes, early will be better. Yeah. So, but I told you that in most cases, so far, the stage 4, the very late stages. But in very rare case, we have a patient with early cancer, like stage 1 or maybe stage 2. Yeah, it works pretty well so far.
Can you show us clinical evidence for the early stage? Maybe do you have some presentation or?
I mean, you mean the cancer again?
Yes, in early stage, do you have some presentation?
I'm sorry, and we cannot show you at this point.
Okay.
But again, I told you that the stage 4 is the most case. Yeah, early stages are very rare at this point.
So, Dr. Nose, may I ask you
Mhm.
for early stage, how many times we should IV the exosome plus? Every 2 weeks for 6 times, or every 1 month for 6 times for early stage?
Usually, almost every month, because the doctor do the infusion of the Exon Plus between the therapy, and the usually therapy is once a month, right? So yeah, that is why the Exon Plus infusion is also once a month.
Thank you. And for stage 4, doc, for
Stage-
stage 4, how many times?
It depends. Some patients, almost every day for a week. Yeah,
Oh,
but usually once a month like this. But sometimes, twice a week or a little bit more, or it depends.
Depends on the
Patient.
suffer, painful, and so on, yeah, doc.
Mhm.
Yeah, thank you, doc.
Thank you.
Okay, thank you, Dr. Nose.
Mhm.
Maybe mungkin ada lagi pertanyaan yang mau ditanyakan tentang exosome plus ini. Bagi peserta silakan kami buka satu pertanyaan terakhir sebelum kita tutup acara ini.
Dr. Oka, sepertinya dari PT Surya Malaysia ada tanya untuk autoimun disuntikan berapa kali itu tadi. Sabrina tadi.
Sabrina, how many times can we inject exosome plus
for the autoimmune?
For the autoimmune.
What do you mean? Well, it also depends on the patient, but well, I say at least once a month. Yeah, And if possible, or depends on stage. I don't know how to say, but it depends on the symptoms. Maybe once a week if possible.
Yeah, if flare up, if autoimmune staging in flare up, usually very painful. So we can infuse it 30 ml every week or every month, every week.
Yeah. 30 to 60. Yeah.
30 to 60 ml of
ml.
exosome
Yeah.
plus. Thank you, Dok.
Thank you.
Dr. Nose, hello, okay. This is a question from AKH. Clinical demography in my question. Early question is like this, man. Nah, can you share to us human clinical subject demography? It means clinical demography in my question means, are there some data? Do you have some data about how many times patient and the variety of disease being treated on Exoplus? Do you have some data for patient being treated for Exoplus?
With which disease?
What is it?
What disease you mean?
Maksudnya data penyakit-penyakit tertentu atau penyakit apa atau secara overall atau bagaimana kan? Research itu kan spesifik biasanya. Coba dia tanya langsung yang bertanya, langsung aja ngomong.
Mungkin IKS, silakan saya kasih kesempatan mungkin. Saya juga.
Silakan dokter siapa ini ya? Sebentar. Dokter ya ini ya?
Dokter Tony kayaknya ya. Atau
bukan.
nih siapa?
Bukan dokter Tony.
Dokter Tino.
Bukan, ini loh. AKH ini siapa ya?
Ya, IKS.
Yeah.
IKS.
The same question.
I can explain for you guys in more detail for Dr. Nose.
Please.
Basically, the kind of question that you guys ask, because in Japan, we got Ministry of Health, there's a Privacy Act for privacy, okay? Basically, I've been dealing with Damais Hospital, Pertamina Hospital, and Sejahtera Hospital. And our company is the one and only recognized by the Ministry of Health in Indonesia. We can build a hospital for stem cell immunotherapy in Bali, Sanur, decree by President Jokowi under the SEC zone. So the kind of question that you can ask whether how many cases that we guys do, this one is a Privacy Act, but we can show the data, but we must be specific. The most important thing right now, BMS is one of the largest stem cell manufacturer in Japan. Okay, one of the biggest. Our parent company is Roto. We are doing
Tolong yang itu ada bocor suaranya Tom.
Here is not today. This Zoom meeting is not. We are trying to sell our product, or we are going to promote our product to Indonesia. It is one our product. This is not a miracle that we use the Exosome Plus, we can cure cancer. But we need to have immunotherapy treatment, then with slightly chemotherapy together with Exosome Plus. All these things is one series of process. We cannot say use Exosome Plus, tomorrow the cancer patient will recover from cancer, no. But it will enhance, it will protect, prevention, and for the cancer patient, they can build up the immunity, Then they can build up the, once you got the immunity, so you can fight cancer, no. So today our purpose here is not I'm going to sell my product to you guys, no. You guys cannot say today you buy Exosome Plus, tomorrow cancer patient will be free from cancer, no. So this is the thing you guys must understand, no. Nobody can promise that our product can cure cancer, but it can prevention of cancer, it can help cancer patient. That is the thing that we can prove, no. Even from Johns Hopkins Hospital, even from University of Massachusetts Hospital, even from Tokyo Medical Hospital, they cannot say like that. But I can dare to say, in the Japan cancer hospital, they are using our product. That is, I can say.
You.
Yeah.
Yes, that's true. That's true, Mr. Richard.
I think you guys have been to my clinic before. We are a very well established clinic. We are one of the best. Even IGT also use our Exosome Plus. Correct, Dr. Don't say IGT. Next time you guys visit IGT, you guys know what I'm saying already. Yeah. So we guys is selected by the Indonesian government, the Ministry of Health have done about 1 year and 8 months due diligence on me, you know. And together with BMS, together, this is our core team, you know. So I can dare to say, our product can protect and help cancer patient, but our product cannot cure cancer patient. Like overnight, the cancer is gone now. So this is the proper treatment, the process, the thing that our oncologists have to prescribe. Then we have to do all this kind of thing. Correct, Dr. Nose? You agree with me?
Yeah. Thank you so much. Yes, you explained pretty well. Yes.
Thank you so much. Because I want you guys to be aware of the things that we have to do. So when we send our products to Indonesia, this is very important. You protect, you enhance for the cancer patient. And especially for PMS, this is a very strong brand. Yeah. Thank you so much.
Okay, thank you. Mungkin sesi pertanyaan sudah saya tutup. Berikutnya akan saya berikan kesempatan untuk Pak Martin.
Biarkan Dr. Sri tolong tadi diterjemahin dulu untuk si Mr. Richard.
Oh, oke. Okay.
Okay, I will translate Mr. Richard what he said. Jadi, Bapak Ibu sekalian, tidak ada yang namanya penyakit kanker, hanya diobatin langsung sembuh, tidak ada. Meskipun secara konvensional. Tetapi Exosome Plus ini diberikan bersamaan atau mendampingi daripada obat konvensional seperti kemoterapi dan lain-lain. Sekalipun di kemoterapi kami para dokter tidak pernah menjanjikan bahwa kanker bisa sembuh dengan kemoterapi, dengan sinar dan sebagainya. Tetapi efek samping daripada kemo, sinar dan lain-lain itulah yang bisa diatasin, diminimalkan, ditingkatkan imun sistemnya dengan pemberian daripada Exosome Plus ini. Sehingga harapannya QOL atau quality of life dari pasien-pasien kanker itu akan meningkat dan kankernya tidak akan membunuh pasiennya. Kalau saya sebagai dokter paliatif begitu, memiliki QOL. Makanya beliau mengatakan bahwa meskipun di Johns Hopkins, meskipun di universitas-universitas yang meneliti tentang kanker, tidak pernah ada ceritanya bahwa satu obat itu bisa menyembuhkan kanker, termasuk Exosome Plus juga bukan obat. Tetapi untuk meningkatkan daya tahan tubuh, imun sistemnya, mungkin juga NK selnya ditingkatkan, sehingga pada akhirnya orang kanker itu bisa hidup bersama kanker tanpa menderita. Kalau palliative care seperti itu, dan ini sangat bagus sekali untuk menghandle, mengontrol daripada kankernya supaya tidak berlanjut lebih parah lagi. Is it right, Mr. Richard? Itu tadi yang saya tangkap ya, Pak Martin, Dr. Oka dan teman-teman semua.
Terima kasih atas penjelasannya, translate dari Dr. Sri. Mungkin Pak Martin ada yang mau disampaikan?
Oke, terima kasih Dr. Nose, Mr. Richard telah diizinkan kami untuk lebih jelas tentang Exosome. Dan kami sendiri pun dari Ola Group terima kasih banyak karena juga sudah sempat 2 minggu yang lalu kami ke Jepang dan melihat sendiri kliniknya di Jepang. Dan kami juga akan berencana untuk ke Jepang juga di bulan Maret. Dan kami juga berharap dari exosome ini dengan beberapa case yang berhasil di Jepang, kami berharap juga di Indonesia pun bisa berhasil dengan banyaknya problem-problem yang timbul di Indonesia. Dan kita sudah coba ada 2 pasien kemarin udah kami injection lokal untuk wajah, mungkin nanti akan dijelaskan oleh Dr. Vanessa. Ya, per wajah itu kemarin ditry dengan 1 ml, ya, dan hasilnya memang cukup menakjubkan. Dan saya berharap nanti tanggal 12 Desember, Master Richard akan datang ke Bali. Dan kami juga berharap nanti dari teman-teman semua yang menginginkan Exosome Plus, nah nanti bisa melalui saya atau melalui dokter, ya, untuk segera apapun nanti gangguan yang diinginkan, gangguan yang untuk diatasi melalui Exosome Plus, itu nanti berapa dosisnya, itu nanti dari dokter Sri bisa kasih anjuran, maupun dokter Oka dengan dokter Vanessa. Nah, jadi saya berharap nanti kehadiran Master Richard di Bali, ya, itu bisa membantu para teman-teman terutama yang benar-benar membutuhkan, sehingga nanti bisa untuk waktu dan tempatnya itu akan saya umumkan mungkin 2-3 hari ke depan. Oke, dari saya, dari Ola Mitra Group, sekian dulu. Mungkin saya akan berikan kesempatan buat Dokter Vanessa untuk berbicara lagi mungkin. Yang kemarin sudah dilakukan kan sudah membawa ke Bali ya.
Iya.
Silakan, Dok.
Selamat malam, terima kasih atas kesempatannya. Saya Dr. Vanessa, mohon izin untuk di kulit sendiri. Kemarin saya experience untuk beberapa pasien pada kulit wajah dan juga ada 1 pasien ke rambut ya. Jadi kulit wajah kita injeksikan secara lokal, suntikan intradermal seperti kita suntikan skin booster, kemudian di area-area yang bermasalah dan ingin dilakukan perbaikan. Misalnya pada contoh kasus anti-aging dengan wrinkle, kemudian smile line ya, jadi kerutan-kerutan halus di wajah, kemudian ada wajah yang sagging ya, yang sudah melorot. Nah, itu dilakukan injeksi intradermal, artinya di kulitnya langsung, di beberapa titik di seluruh wajah. Itu setelah diamati dalam 1 minggu itu terjadi perbaikan klinis. Artinya karena kulit kita itu organ paling luar, jadi kita bisa mengamati secara langsung ya dengan penglihatan. Wrinkle bisa berkurang sampai 50-70% dari yang saya amati. Kemudian dari skin quality dari kelembabannya ya, kelembaban yang baik itu berkisar 60% ke atas. Terjadi peningkatan kelembaban yang saya ukur dengan menggunakan alat yang memang sebelum dan sesudah itu terjadi perbaikan klinis dan secara objektif meningkat sekitar 30%. Nah, kemudian untuk rambut ya, rambut ini sendiri karena proses pertumbuhan rambut itu memerlukan waktu sekitar 1 bulan. Jadi karena produk yang saya bawa ini belum 1 bulan, untuk masa follow up-nya saya masih belum bisa sampaikan. Nanti ketika datang akan saya sampaikan ya. Kemudian untuk beberapa case seperti kasus-kasus jerawat ya, kasus jerawat meradang yang kita tangani, ternyata injeksi Exosome Plus ini sangat membantu mengurangi peradangan, sehingga teman-teman tidak perlu khawatir ya untuk kasus jerawat. Exosome ini malah membantu untuk meredakan
Halo, Van.
inflamasinya yang seperti disampaikan
Kamu di mana,
bahwa
Van?
ada
Mohon maaf, siapa?
pengurangan
Bocor suaranya siapa? Bu Sinta saya. Tolong di-mute dulu, Bu. Terima
iya,
kasih. Silakan, Dr. Vanessa.
ya. Di mana yang tadi disampaikan sama Dr. Nose ya, jadi mediator kimia seperti interleukin 6 dan 8 itu akan berkurang. Itu yang menandakan peradangan. Nah, untuk kasus-kasus autoimun dari saya belum saya berikan gitu. Cuma tadi sangat menarik dan ada peluang untuk efektivitas ya. Kita bisa jadi banyak kasus yang dari bagian kulit seperti lupus, kemudian skleroderma itu bisa kita trial dengan exosome plus ini dari teorinya akan memperbaiki sistem imunitas kita. Bahkan untuk kasus-kasus alergi kulit seperti itu. Ini sangat suatu pencerahan ya, suatu teknologi yang dapat kita terima untuk kesehatan di masa mendatang yang lebih baik. Seperti itu. Oke. Oh ya, satu lagi saya sampaikan untuk kasus misalnya masalah kelamin di mana terjadi aging proses, bisa terjadi penurunan fungsi seksual. Kita bisa aplikasikan untuk mengatasi masalah tersebut, misalnya dengan kelainan disfungsi ereksi pada penyakit-penyakit diabetes. Kita bisa suntikan secara lokal di area kelamin, di mana risetnya sebenarnya sudah banyak sekali, dan hanya saja saya belum mendapatkan kasus. Mungkin kalau ada yang memiliki masalah, kita bisa trial dengan pengobatan exosome plus ini. Oke, terima kasih. Sekian, mungkin ada yang ingin ditanyakan, bisa langsung menghubungi saya atau di forum ini bisa. Saya kembalikan pada Dr. Oke.
Oke, terima kasih Dr. Vanessa untuk sharingnya. Tadi sharing dari Dr. Nose, dari Dr. Vanessa, dan Dr. Itu semua semoga dapat bermanfaat bagi teman-teman sekalian, supaya teman-teman tahu apa itu exosome plus, supaya Anda jelas bagaimana nanti ini akan masuk yang dibawakan oleh Olah Group. Begitu. Untuk pertanyaan yang belum terjawab, atau misalnya teman-teman sekalian ini masih ada pertanyaan, Anda bisa menanyakan kembali ke Dr. Vanessa atau ke Pak Martin juga bisa. Nanti kami akan bantu jawab kembali. Ya, jadi bisa kami bantu jawab, tanyakan ke Dr. Nose pertanyaan yang belum terjawab. Atau misalnya Anda masih kepikiran ada pertanyaan-pertanyaan yang lain. Mungkin sekian acara webinar ini. Kami ucapkan dari Olah, ucapkan terima kasih teman-teman sudah hadir, Bapak Ibu sekalian, dokter sekalian hadir di acara ini. Mungkin kita akan dapat bertemu berikutnya di tanggal 12 yang tadi Pak Martin bilang. Betul ya Pak Martin?
Betul.
Ya, di tanggal 12 nanti bisa...
nanti waktu pastinya akan saya sampaikan lagi.
Oke, nanti bisa ketemu di Bali ya Pak Martin ya, tempatnya
Betul.
nanti di-update kembali, begitu?
Betul, betul.
Ya, mungkin itu aja. Pak Martin ada yang mau sampaikan kembali Pak?
Udah, terima kasih banyak Dr. Nose.
Terima kasih Dr. Nose.
Terima kasih.
Terima kasih Mr. Richard.
Thank you for Dr. Nose and Mr. Richard.
Thank you so much. Terima kasih.
Arigatou gozaimasu.
Arigatou gozaimasu.
Very good. Thank you.
Terima kasih kembali.
Arigatou.
Terima kasih.
Terima kasih.
Terima kasih Bapak Ibu
Selamat
semua.
malam.
Sampai malam.
Bye-bye. See ya. Thank you for your attention. Ya, terima kasih.
Yes, sayonara.
Arigatou.